I am Dr. A.K.Pancholia from Indore, practicing for last 42 years and more involved in the preventive cardiology. Today I am here in the main conference of the Indian Society of Hypertension, and here my talk was on management of heart failure with reduced ejection fraction, what the guideline says about the treatment. As you know, the heart failure is a important cause and important complication related to hypertension, and hypertension is an important comorbidity in heart failure patients. In India, it is around 57%, so 57% chance in patients hypertension, there are chances of getting heart failure. With the increased morbidity and mortality, now why there is increased morbidity and mortality? Because the patients are not taking the guideline directed medical therapy, or the physicians or cardiologists are not prescribing the guideline directed medical therapy, which is actually recommended by the American College of Cardiology and European Society of Cardiology. Recently, the American College of Cardiology 2022 recommending the frontline drugs, the guideline directed medical therapy in the form of ARNI, that is sacubitril valsartan, SGLT2 inhibitors, MRA, that is a mineralocorticoid receptor antagonist, as well as beta blockers. So these are the 4 frontline drugs which are to be recommended in these patients for the better outcome. But unfortunately, because of the clinical inertia and other factors, the patients are not on this guideline directed medical therapy. So here I discussed about 4 clinical scenarios where the guideline directed medical therapy is recommended as the first line. One is the patient with a chronic heart failure with reduced ejection fraction, patients with the acute heart failure or acute decompensated heart failure, and the patients who are de novo patient. De novo patient with the patient not on any of the ACE inhibitor, ARB or any heart failure therapy, and admitted for the first time and first time detected as heart failure. So in all these clinical scenario, the sacubitril valsartan, SGLT2 inhibitor, MRA and beta blockers are recommended as a class 1 level A recommendation by the American College of Cardiology, and which show the better outcome. In the Paradigm HF trial, in the chronic HFrEF patients, there is a substantial 20% reduction in the outcome with the ARNI compared to ACE inhibitors. While they are also recommended, these patients should receive the ARNI or the sacubitril valsartan in the hospital itself when they are admitted in the hospital. And there are studies which are carried out when you start ARNI in the hospital and after discharge, and there is a better outcome if you give ARNI in the hospital when the patient is already in the hospital. So these patients have and they can adhere to the therapy, compliance is improved, and they continue with the therapy, so the outcome will be much less. So recommendation by the American College of Cardiology 2022 recently and the ESC guideline 2021, these 2 major guidelines clearly recommend that patients should be on guideline directed medical therapy. The 4 front pillars of the therapy like ARNI, beta blockers, SGLT2 inhibitor, MRA to be given in these type of patients for the reduction in outcome.